Welcome to the Repro Files, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Repro Files.
Infertility, injustice, and all things nobody warned you about.
Welcome one and all back to the Repro Files, Infertility, Injustice, and all things no one told you about. I am your host, Elizabeth Lee.
And I am your other host, Anne-Marie Luft, bringing you all this new news that we have in the news cycle this
the
week.
news cycle has been quite busy. So we thought this episode we would bring you just kind of a breakdown of some of the news that's happening across the country with regard to reproductive health and infertility and all the things, and just sort of talk through it, because I think, gosh, a lot happens in a week in the American news cycle and the global news cycle, and it can be hard to keep up. And some of these things, I think, they get buried. Yeah. So let's do it. I mean, last week we talked about endometriosis, and I was, very privileged to be able to share my own endometriosis story. And then I think it was that afternoon you had sent me, I think you had sent it to me, or somebody had sent it to me, that there was a film, and obviously it was no coincidence that it was put out when it was, but a film about endometriosis that won a BAFTA award, which I thought was just awesome in terms of, awesome for them and the film, but also awesome from an awareness perspective.
Absolutely. We appreciate you sharing your story. I think that a lot of people can identify with you, or maybe didn't know much about endometriosis and how much it impacts women's lives. So I think it impacted people, and we appreciate you and thank you for sharing all that you did last week. And yeah, so the story, this film, it's called This is Endometriosis. It's a story of Georgie Wildman, who had 7 surgeries and she lost 4 organs. Four organs. Like, this is the story of
I only
someone who
lost
is
3. That's impressive.
that's
I mean,
what? 4
yeah,
organs. That's just crazy.
but the reality, that is a true
Oh,
reality. I mean, not to divert too fast, but I remember when I was being surgically consulted for my endometriosis surgery, and I basically had to sign papers that I could wake up with a colostomy bag, because
mm,
you can have, damage in the intestines all over. So it's 7 surgeries and 4 organs, man.
yeah, that's a lot. And the film, it's a story of someone who wanted accountability from the medical industry. Basically, the outcome is believe women and stop dismissing them. So we salute you, Georgie. Keep up the good fight, and congratulations on that BAFTA award.
Yeah,
Well
that's
earned.
incredible. Seriously, truly. You are welcome. If you would like to be a guest on our show, let us know. Send us an Instagram. But seriously, when you put yourself out there, you're willing to be vulnerable and share your story, there is no telling how far that impact travels.
Yeah, yeah. And so moving on to other news, there's a new study that was put out this week, a new study published in Hypertension. That's an American Heart Association journal. Had no idea that's the name of it, but
I like the
sounds
name.
sounds like a good one. Yeah. It reported that women who experience a pregnancy complications like preeclampsia, preterm birth, stillbirth, or having a baby that was small for gestational age, they may face an increased risk for cardiovascular disease later in life, like years later. And for those who report high stress levels during pregnancy, there's a more elevated risk for high blood pressure. Again, not just during the pregnancy itself or immediately following the pregnancy, but this can happen, they said, 2 to 7 years later. And even farther into life. High blood pressure, has lasting effects on the mother's health. I know I know people who have had preeclampsia and they were put on blood pressure medication and they still continue to be on blood pressure medication, and their children are 6, 7 years old. They're still on it.
It's one of the deadliest parts of pregnancy,
Yeah.
because preeclampsia and even post preeclampsia is often, not often, but I would say maybe talked about a little bit more in terms of what to watch out for. If you have a good OB who's doing good education, I don't know that we do a good enough job. Now, I haven't been in labor and delivery in 15 years. A friend of mine, we were baby fertility or baby L&D nurses together once upon a time, and she was sharing this story with me on over the weekend about her wife who ended up with postpartum preeclampsia, effectively preeclampsia after the baby's born, which is even more insidious because women often attribute the symptoms to other things. So, they get their feet get really swollen, but they're like, okay, right before I had the baby, my feet were swollen. So that's probably normal. And there's just like a number of things. Now, what was I found fascinating was about this story about her wife suffering post preeclampsia. I think at one point she said she didn't even know her own name. Her blood pressure was like 200 over 120. It was really serious. And my friend, who is now an advanced practice women's health nurse, if she hadn't intervened, it could have been a really different outcome. So, and then when you think too about the cardiovascular implications of having high blood pressure, it really has damaging effects on the blood vessels. And so it's not really a surprise that you can have those like long-term increased cardiovascular risk. But I just think we're not talking about it enough. And I think, did you
Well,
talk
I
about?
mean, we also don't talk much about women's heart health in the fact that women have different heart attacks than men, right?
Yeah.
It presents itself as different than what you imagine on, TV, like, "Oh, my heart. Oh." It's not that anymore. It's like an upset stomach or,
Yeah.
shoulder pain or jaw pain or whatever. And as women, I think we usually kind of like, "All right, well, I have a little of a stomach ache. Okay, well, I'll take some Tums and be done with it," kind of thing, or I'll take some Advil for some pain in my shoulder. We
Right.
don't equate that, and
Yeah,
we kind
again,
of like
attributing it to other things.
Mhm,
So, and as you said at the top, believe women, please
mhm.
aren't told many things. But women are at an increased risk of having their pain dismissed or disregarded altogether in healthcare settings. Yeah, you hear stories like these and you say, it really is an absolute marvel that pregnancy is what it is. It is risky as it is. I think that's the unspoken truth of it is that when you are pregnant, you are at like super high risk for a whole bunch of different things. And we just don't really talk about it.
Yeah, and I think there's another thing women are going through fertility treatments. We always check their blood pressure. If they have high blood pressure at the time, we want them to get that under control before they get pregnant. Many women don't even know that they have high blood pressure until, they are pregnant. So all of these different things, we need to be conscious of our health and being seen. Going back to what you said about post, partum and still having the high blood pressure, a lot of women don't have the option to see an obstetrician after pregnancy. We've talked about this in the past, and I think we've talked about it a lot about how there are maternity deserts out there. So you travel hours to get to a hospital, you deliver a baby, you travel hours home to get home, and then you still have that high blood pressure. Well, are you gonna travel hours again to be seen postpartum?
And do we really feel that we're equipping and this is something where we could do so much better in terms of healthcare policy for rural America at, providing a better education to the general practitioners, the family practice doctors, and the groups of people that are at these folks' disposals, especially ER physicians that the board of or the ER professional group or whatever maybe needs to do a better job at providing educational resources in ERs to help those types of environments that maybe don't encounter these things as often. But that's a really good point. You don't necessarily even have the option to go back to an obstetrician. And regardless, you don't have a ton of time and you're trying to care for a newborn. So and I think it's why it can be so deadly because again, you're exhausted, everything, all of the massive hormonal shift that takes place in that week after delivery is just magnificently crazy. So yeah, we definitely need to do a better job at educating broader groups that could potentially be in a situation to encounter those types of situations that if they recognized earlier, we could save lives because you do have to ask yourself too, like, how many postpartum how many moms die postpartum and we don't hear about it,
Right.
attributed to something else or what have you. So anyway,
Well, with the study also just further on down the line, when you get older, as you see your primary care physician, I think it's important that you bring that point up. Like, hey, I had preeclampsia when I was pregnant. And hey, I had these types of things during our pregnancy. So sometimes, it is stress. It is very stressful, but it's very important to bring up these types of things with your physician further down the line because the studies are showing that, cardiovascular health is impacted further down the line, not just around the time of
well,
pregnancy
and
and
again,
delivery.
it makes sense. Gestational diabetes in pregnancy puts you at an increased risk of type 2 diabetes later in life, and I think similarly, the physiology of that makes a lot of sense.
Yeah.
So, shall we switch to another newsworthy discussion this morning?
Yeah, so everybody's talking about AI, right? AI. We even talked about it. I brought it up last time. AI in nursing. I'm like, how is that going to work? But I mean, I do see that there are good things about AI in nursing that can help us, certainly. So last month, the Association of California Nurse Leaders, they had a conference and the ANA, which is the American Nurses Association president, Jennifer Mensick Kennedy, she had the keynote speech. And she did focus on AI. She's been told by the AI companies that AI will do 95% of healthcare diagnosis in this country in the next 5 years? I thought that was a little much, I guess you could say. You
5%
know
in 5 years. I mean, that is potentially exciting
Mhm,
in that if we use it appropriately,
mhm,
the right guardrails on it,
mhm,
cure disease. If we focus on how to use it for the greater good and not for the greater profits to the already billionaires and trillionaires, I think that could be seen as a good thing. Think about how complex diagnostics is or the process of diagnosis is. Providers come up with what's called a differential diagnosis, meaning, okay, I've done the history, I've done the physical, what could it be? And then from there, going down the different rabbit holes to try to get the right corroborating diagnostics that prove one over the other. I think that we are terrible at healthcare diagnosis. I don't know if that's because I have no idea if that's because we don't do a good enough job educating. I'm not sure entirely why we do such a terrible job. But when you think about the idea that most of diagnosis and some medical professionals listening might argue and please do. I mean, as I'm a registered nurse, we don't diagnose people. We nursing diagnose people. It's different.
way
But
different.
I think way different. But I think diagnosis of disease is primarily algorithmic driven. If this, then this. If this, then this. If this, then and not this, then that. But if it has this, then it's that. So there's a lot of decision trees, if you will, that make up the diagnostic process. And I have a great example for this. In 2023, I had gone home to see my family for the first time since COVID had started, because my father couldn't get vaccinated and I just did not want to bring it to him. When I got there, my stepmother had been complaining to me over the phone for a couple of weeks of just kind of not feeling well, nausea, just these diffuse symptoms, right? And then I got there and I saw her and she told me more about it. And then as the days went by, I said to myself, this is her doctor is missing something. She's been complaining of these symptoms for 6 months. And in my head, because I had intrahepatic cholestasis of pregnancy or ICP, where your bile acids, when you're pregnant, speaking of high risk pregnancy things, they don't process properly and they get deposited in the skin. And as a result, you become very itchy. And so I started thinking as she was telling me her symptoms, I'm like, this sounds very biliary, gallbladder, pancreatic, something like that in nature. So this was 2023. Fall of 2022 was when ChatGPT hit the market. And this was 6 months later. And there were some other AI type tools out there, and I came across one that was for diagnostics. It was actually a tool created for medical students to learn I'm not sure how to put it, but it's basically to try to learn the thought process of algorithmic diagnostic determinants, I guess, if you would say. Anyway, so I found this tool and I used it to prove my theory. Well, to prove, I guess, to corroborate my potential theory that this was biliary in nature. And when I clued into that, it's what made me decide to take her to the emergency room. And she had stage 4 pancreatic cancer.
Wow.
Stage 4 pancreatic cancer. And that was one of the potential diagnoses that was put before me in that. Now, let me say that only because I fed the model an excellent, excellent history. And see, that's where I don't know. I'm not sure if AI can replace a really, really thorough history taking, potentially. Because I had medical training, I took a very thorough history, and then I input that all into this model in a way that really like a doctor would present it to another doctor. A 72-year-old female presents with symptoms of blankety blank for this long, all the things. So I think that within 5 years, 95% of healthcare diagnostics being done by AI is a very realistic, but I mean, there's been some legislative pushback. For example, I know in California and Oregon both, and this seems funny to me that this had to be done, but California and Oregon both have passed laws that basically prohibit a chatbot from calling itself an MD or an RN, which is
Hmm.
so interesting to me, right? Because
Right.
technically AI can tell you whatever you want to hear, and you don't
Mhm.
know really truly right or wrong. That's where a lot of its risks lie. I know down in the Arizona legislature right now, they're hearing from a bill that wants to deem your communications with AI chatbots as privileged information, similar to that which you would have a conversation with an attorney or a doctor where that would be protected. And I mean, that's really scary, right? Because then you start getting into like major transparency issues. But I will say about that, what chatbots can and can't call themselves, the term nurse couldn't be protected. So RN could, but the term nurse couldn't. So I thought that was very interesting.
It all reminds me of, Big Hero 6. You saw that movie, Big Hero 6?
Yeah.
Baymax. The story is that Baymax is like a nurse, right? That's what when he presents it, he's like, "Oh, this is really gonna change medicine." And Baymax would just kinda, like, scan the body and be like, "Oh, you have this." And, which I was like, "Okay, alright." And I think that with AI and nursing, it's absolutely going to change everything. Nurses are still going to be needed. Registered nurses are still going to have a role. I think AI, it's just going to complement their work in not just
We're gonna have
hospitals, but in clinics. Helping to get, for example, one of the things that I had a hard time when I was working in the hospital was all these medications. Right, I worked on a med surg floor, so every patient was on like a billion medications, and I would have to look them all up. I think
yeah.
that's something that would be, advantageous, that's going to help my job, that's gonna make me work better. I think that that would be really advantageous to nurses on the floor. I can't remember every single medication out there. I would have to learn them, look them up because we have generic names, we have brand names, and then there's new medications coming out all the time. And I think it's important to keep on top of that. Yes, but it's impossible for us to learn all of them all at once. And so that's one of the cases that I think AI is definitely going to help. It's going to help organize our work. It's going to help us work smarter, but it does not take away, obviously we need human interaction and nurses are still going to be required to do the actual work. And the actual physical and emotional work for that. So AI in nursing, I think, is something that is going to be there, and we all need to embrace it. It's not going to replace us. It's just going to help us work smarter.
Yeah. And we have to process, as I said earlier, if we use it for the greater good
Hmm.
versus the profit margins for billionaires, think about what this could do.
Hmm.
Think about the rate of burnout in nursing. What if, because we have this incredible technology, we could now, instead of nurses having to work 3 12-hour days, they could work 3 6-hour days or something like that. The first 3 hours of I'm just thinking out loud, thinking
Mhm.
about ways that we could use AI and the way that it can serve the field by giving some of that time back to people. You think about how much time we spend away from our families, that we spend at work. We have this hustle culture of
Mhm.
always gotta be moving, always gotta be busy, right? Ignore your mental health, ignore your physical health, just keep going. Imagine if we could use AI and the abilities that it has to fix some of the things that are really broken in terms of how we consider work and how we think about work,
Yeah,
society.
I bring up stuff from pop culture all the time. There's a show called The Pit. I don't know if you've watched it.
I've not watched it much, but I hear it is all the rage.
It's actually really good.
I've
So,
heard, I've heard I
yeah.
may have to go for it.
I'm on season 2. So in season 2, they introduce a new doctor, new character, and she's really big into AI, she's really big into tech, and she wants the student doctors to use AI for their charting. And there was one episode where they did, but there was a mistake made. There was a mistake made in AI. They put the wrong I think it was a wrong disease that they had put in a person's chart. And it kinda changed they were like and the person from upstairs comes downstairs and is all like, "You said this person had this, but they actually had this," and so the thing is that we need to make sure that we are reviewing. It's not just there to write everything for us, we're there to review it as well
And
to make
it
sure
was
to cover those mistakes.
think about how it was unleashed on society with 0 instructions,
Mhm.
guardrails, whatever, right? And the problem is that it is highly biased. So, to the unsuspecting person, it could sound really confident in what it's saying and be spouting something completely untrue. I mean, there are well known instances of AI hallucinating
Mhm.
where it effectively just makes up a fact that it doesn't have. So I think that's where we've got to be thinking really long term because the snake's out of the cage at this point. What are we going to do to, protect against the potential malfeasance that could come as it's profit driven? Anytime something is profit driven, there's a huge opportunity for exploitation. And I see that, unfortunately, I see that all over this because, if Reagan taught us anything, it's that nothing trickles down. I'm not feeling the trickle. I don't know about you, and I know most of America right now when they're paying $4 for gas and $6 for, uh, a dozen eggs, I guess, are probably about $6 right now. They're not feeling that, and so something like this with the ability to make certain people really, really rich, yeah, lots of red flags, and in my mind, the key is legislation. We've got to legislate guardrails to protect this further exploiting humans.
Yeah, it's important that you treat the patient, not the computer, right? Not the I just renewed my ACLS last week.
Ooh, fun time.
And yeah,
So if
that
you don't
the
know it, a
strips
good
the
cardiac
stripes always
support,
get me.
it's a doozy. Any nurse will tell you ACLS, oh, dude,
Yeah.
it's not an easy one. It really isn't, and it gets me every time too. The strips, the coke drugs. I'm like, amiodarone. What's the number again?
Yeah.
Anyway,
What is it, 300 or 150?
right, right,
Go,
exactly that.
But, one of the things the instructor, he was bringing up scenarios, and it is really made you think. It really made the group of us think. What if this was happening? And then we all said, what medication we should give or what the intervention we should have done. And he was like, guys, you need to treat the patient, not the screen. Just because you see something on the screen doesn't mean you automatically go with that intervention. You have to treat the patient and not the screen. So that it's very important that you still have, nursing and all the medical people. We can rely on AI for certain things, but we still need to treat the patient, not the screen.
Yep. So well said.
Yeah.
Well, there's some interesting news for our infertility patients listening. And this, I didn't think I'd ever say this, but this comes from Glamour magazine.
Yes.
And so we covered the Trump RX thing a few episodes ago, but Anne Marie, we have some news on that, an update.
Yeah. New news. New
New
news.
news.
New news. So Costco, Costco, the place you get all your bulk items from, they are partnering with Sesame and EVRMA to offer self-pay patients expanded access and more affordable care for their prescriptions, for their medications. So Sesame it's a innovative self-pay healthcare organization that has a platform that operates in all 50 states and connects patients with doctors without insurance, not that middleman insurance. And it's not just fertility, it's for any healthcare stuff. So you can just kind of go on there and get attached to a doctor 24/7. So EVRMA. So disclosure, I used to work for them. I worked for them for many years. That's where I started my fertility world at RMA New Jersey before they were EVRMA. So it's one of the largest clinic groups out there, right? They're leaders in the REI, the reproductive endocrinology and infertility world. They started in New Jersey and now they're a global entity.
A massive, massive shout out to EVRMA's CEO, Lynn Mason. I got to hang out with her last weekend or when I was in DC recently. And I remember when she was named the CEO of EVRMA, and I was just like, Queen, he's just really guided them in such a strategic way. So, but so you're saying Costco members have now, just by virtue of being a Costco member, you have access to this Sesame platform?
Yeah, so it's at $99 a month if you have a Costco membership. And you can just go on to Sesame and get access to a doctor.
And what do you get for that? Just consultation? No treatment, right?
You get no, correct, right. You get a consultation, and if they, feel that you need to move on to do IUI or IVF or any other type of fertility treatment, then they seamlessly connect you with EVRMA, with a fertility specialist at EVRMA. So they have these discounts for your medications through Costco. This is just prescriptions, right? It's not the price of the actual cycle itself. You still have to pay for labs and procedures and, the fertility treatments at EVRMA. So that is not included in your monthly membership. I mean, gosh, wouldn't that be nice?
Well, yeah, I wanna learn more because it's interesting because, yeah, I mean, now it sounds like they've made I mean, in Costco, I like Costco generally. I think they have been one of the more upstanding corporations in our in our society. Lots of questions there. Yeah, it's interesting.
Yeah, it's interesting. It was a very interesting collaboration. I was actually kind of a little surprised when I saw the news. I actually saw the news this morning. So I was like, oh, this is a very interesting take. And I'm wondering, are people going to be driven to, hey, I need to become a Costco member? Like to get this service? You can actually go to Sesame without a Costco membership, but they're just offering a discount with this through Sesame, through Costco.
Fascinating that Costco members could get discounts on, medication, but is it all the meds? I think there's just a lot to know. As of yet, it seems like Sesame gets the patient into the practice sooner than the patient calling the practice directly. But I also feel like I have questions about that as well. Like, does that bump a patient that has been waiting? Lots of questions, but it's good because it's something. It's progress. It's movement. We how many months and months did we lament that there was all this talk and no action? So it is exciting to see more action, um, moving. So hopefully it keeps going.
Yeah, I think that we're moving closer and closer, and we're trying to come up with innovative solutions, right? That's the whole point. We have to come up with innovative solutions because there's no other choices that we have. So trying to get access for all, we're kind of doing this roundabout trying to get things done. So I think that EVRMA, Sesame, Costco, they're trying to help people. May not help like a lot, but it's gonna help
It's
regardless.
gonna help somebody, and right
It's
now,
going to.
we'll take anything we can
We'll
get.
take anything right now. So basically, go get your tires and go get your rotisserie chicken for 6.99 and get your fertility meds at Costco. After all, Costco's motto is do the right thing. So they're
Well,
doing the right thing, I think.
okay, cool. Stay tuned. Let's stay tuned. I know we were gonna bring up an update on that case of the embryo mix-up in the
Hmm.
Orlando area. That's a clinic in your area, right?
Yeah, so that clinic is not far from my house, actually in Longwood, Florida, which is just outside the Orlando area. We talked about it a few episodes ago, embryo mix-ups. So a couple had a child in December, a baby girl, did not match the ethnicity. They were genetically tested. Their child is not their biological child. Went back to the clinic, basically suing them. What happened? What went wrong? So an unnamed couple recently came forward saying that because they published their picture, the couple who had the baby girl, they published their picture in the newspaper. So someone saw them, an unnamed couple came forward, and the woman was like, "Hey, that baby shares the same complexion as my husband." And they actually delivered a baby boy in December because they were transferred on the same day as this couple. So they were transferred on the same day. Yeah. So now the genetic testing is currently underway. So I just wanted to keep everybody updated on this story. It's a fascinating story. And as the results come forward, we'll just keep bringing it to you. I think we addressed a lot of the things that had to have gone wrong for that
Right.
to happen. But it's interesting the fact that this new couple, this unnamed couple, they were transferred on the same day.
That's wild. Didn't we talk about in that episode, how would you ever find
Hmm.
how would you ever find but that makes sense. I mean, it transferred on the same day. I mean, now we're getting back to these were 2 thawed embryos and the dish got mixed up, right? That now sounds like the most plausible explanation is that both patients were scheduled for a transfer on the same day and got a transfer on the same day, but something with the witnessing of those embryos went wrong because somewhere those dishes got swapped. But gosh, I mean, what a tragic story. How old are these children now?
A few months.
Few
It was
months. Okay, I
born.
wasn't sure
They
how
were
old.
both born in December of
December.
2025.
Okay, so a few months old. Yeah, that is boy, I mean, it's a boy and a girl, so
Hmm.
that's tough because these I mean, gosh, on so many levels, the bonding that took place
Hmm.
in these families, boy, I'm certainly glad that they're figuring it out, right? Sooner the better so they can heal and figure out how to move forward. But yeah, well, let's talk about Dateline. In Wyoming, Governor Mark Gordon signed a bill to ban abortions after embryonic cardiac activity at 6 weeks. So this is now the fifth state, I think, to ban abortions at fetal cardiac activity. And it's even tough to say heartbeat because it is not a heart
Hmm. Yes.
time. It is not. It is, as we call it, fetal cardiac activity for a reason. It's electrical activity that we can detect, or motion activity that we can detect. But anyway, yeah. So Florida, Georgia, Iowa, South Carolina are the other states that ban abortion at that juncture. I think it's extremely important to call out the Georgia case of the patient who was kept alive because she was 9 weeks pregnant or something like that. She had a fatal, some sort of, I don't know, remember if it was a stroke or something happened. But these are dangerous. And Governor Gordon himself stated that he had misgivings about the law because it didn't include exceptions for rape or incest. But it does have an exception for preserving the woman from imminent peril that substantially endangers her life or health according to appropriate medical judgment. So I don't even know what that means.
Right? Yeah.
Like,
What
let's
does that mean?
so many women. Go talk to the women in Texas and
Yeah.
see if that works, because I've told this story before on this show, and I will tell the story until I'm blue in the face about not long after Roe v. Wade was overturned, I had a patient in Texas who had to go to the emergency room 5 separate times with a live ectopic pregnancy. that burst, the tube burst in the parking lot on the fifth trip to the hospital, and then they took it seriously. So, an exception to preserve the woman from imminent, that whole thing,
Mhm.
that is fraught with issues.
Yeah. Again, it's how sick are you when we can treat you? How sick
Right.
do you have to be for
How
us to
sick do
treat
you
you?
have to be for us to treat you? And that, line about the preserving, that that has no actual objective ways of making that call. And so we're seeing more and more that providers are being hamstringed by legislation because there's now this fear of, like, I know the Arizona legislature is fighting right now about, if a, I'm trying to remember how it is, but if a mental health provider even so much as discusses gender affirming care with a patient, they can be sued. I mean, there's all of these, like, this legislation which criminalizes providers, puts, again, ask the woman in Texas how this has worked out, ask the woman in Georgia how this has worked out, because you've made it so tight, but yet so vague that medical providers are like, "I'm not going to jail." It's really dangerous. It's extremely, extremely dangerous, and
Yeah.
it makes me really bummed to see yet another state going in this direction.
Yeah, and, I worked at Planned Parenthood when the 6-week thing came down. I saw firsthand what the women had to do. If you were 6 weeks on the, because in the state of Florida, you have to go 2 days. You have to be for your initial, and then you have to come back 24 hours later. It has to be 24 hours. If they saw you at 3 p.m. on a Monday, you couldn't come back for your care, your abortion care, until 3 o'clock on Tuesday. So, if you were 6 weeks on day 1, you're done, right? You have to go out of state. And, some women, they don't have the time. They don't have the money. They have children of their own. They have to travel and all of that. This also reminds me of another story that I read about this week. And I don't know if you read this story about the woman in Tennessee who went in to have, a sterilization. And she was actually in the hospital. She had her IV in,
Yeah.
and the hospital, they stopped her from being able to do the surgery because they wanted to preserve her fertility or her ability to have children in the future. Now, the hospital system was, I believe, a Catholic hospital system, but still, she made the decision to, have sterilization done. Her doctor agreed. Her doctor made the appointment. She made the appointment. They did all the pre-operative things that you got to do. She goes to the hospital. She's got changed into that hospital gown. She's, sitting on the stretcher with an IV in her hand, and they said, "Nope, we can't do it."
Oof. I mean, it won't all be doom and gloom. I will say that the Arizona in Arizona in 2024, voters, with a ballot measure, passed a 15-week Arizona constitutional amendment, a 15-week access to abortion law, and it earlier, I think actually later last month, they struck down some state abortion restrictions, that including that 24-hour waiting period. So that was a huge win for patients in Arizona. And then also the telemedicine bans and putting restrictions on abortions due to genetic conditions, those restrictions were struck down. So this is an interesting time in our existence of how, again, how this stuff is being litigated and how the real, what the real life implications are for people. So anyway, but since it's Women's History Month, we
Mhm.
should talk about, I know you have a favorite when you think about women's history. You have a favorite, nurse, right?
I
That you
mean,
look up to?
I have a bunch of favorite nurses. I got 2. How's that?
Okay,
I'll say the first one, Margaret Sanger. So Margaret Sanger, she was a nurse back in the early 1900s, I believe. She was in New York City. She worked with slums, and she visited a lot of working class immigrant women, and she assisted them, childbirth. She also assisted with women who had miscarriages and self-induced abortions. So she saw that these women were doing self-inflicted or self-induced abortions, and they were getting really sick. They were getting infections. She thought, hey, you know what? Instead of these women having to do these self-induced abortions, why don't we just allow them to have contraception? That's a novel idea.
so radical, Margaret.
Yes, and she even had a newsletter, and I love her newsletter title. It's called The Woman Rebel. Yeah, I like that. And she basically was going up against that Comstock Act. Do you remember we talk about Comstock
Oh, yeah.
Act? Even today it's being brought up. It's the act where you couldn't they prohibited it's like an anti-obscenity law, right? So male contraception or even information about contraception was prohibited, and nowadays they're trying to use it to get Miffy, so you can have Miffy sent to other states, things like that.
And Miffy is, for those of you who don't know, is mifepristone, which is
Mhm,
the very, very safe drug that's used, for medication-assisted abortions. But yes, they're effectively, weaponizing. I think the Comstock Act is, like, from the late 1800s, if I recall
mhm,
correctly. So, weaponizing that to further suppress and oppress women.
yeah.
Great.
So, having contraception, Sanger believed that, the danger of self-induced abortions and getting infections and all of that, that danger would disappear if women were able to prevent unwanted pregnancies.
Yeah.
Shocking, we are still fighting for contraception now with birth control pills and IUDs and all of that. So we're still fighting this fight. So the other nurse is, of course, Jean Purdy, who was the first fertility nurse. We've talked about her, and she was a pioneer in embryology. She helped with develop IVF, and her contributions were finally recognized in the 2010s. And then a couple years ago, gosh, I think it's been like 2 years now that the movie's been out. The movie Joy on Netflix. I'm still gonna promote that. Go watch it, please watch it. It's so good. Yeah,
So good.
she helped with the first IVF baby, Louise Brown, in the
Yeah.
UK.
Yeah, and, obviously here in the US, our first IVF baby was born in Virginia, Elizabeth Carr. She actually had her parents lived in Massachusetts, but IVF was illegal in Massachusetts. So she traveled to the Jones Institute in Virginia for her mother traveled there for IVF, and she embraced that life that she was born into.
Oh my gosh, if you don't follow her on Instagram, you need to follow her on Instagram. Love her
Yeah.
Instagram.
No, she's still very active in the IVF community, and it astonishes me when people still post, insulting messages to her. They still taunt her in comments and things like that. She's posted about this, so I know she got a message that said something like, "Elizabeth, you being the first IVF baby isn't something to be proud of. It's a warning. The technology that opened the door to designer babies and humans thinking they control life just because it didn't worked in your case doesn't mean it's moral. There's consequences to playing with embryos in a lab, and IVF is harmless, but it's not, and it shouldn't be normalized. And the fact that you promote that like it's some beautiful story is exactly why it's the problem. Like,
Ew,
ew,
who are you? Right?
are you,
Right.
keyboard warrior, sir? Like, it is something to be proud of. What the heck is it a warning of?
Mhm.
Infertility affects 1 in 6 people. If you would like mankind to continue, let us know then, sir, if you have another alternative option, because right now, that is medical technology that gives people families, and I am one of those people. My son was born from IVF. It is a beautiful story. Sometimes there's 2 things she tells me. I actually got the blessing of seeing her a week or so ago in Boston, and she told this story, but this is another story she tells that I think is funny. Someone asked her dumb questions that she gets asked, like, "Do you have extra DNA?" And she goes, "Yeah, it's called personality." And then she gets asked, "Do you have a belly button?"
I love it.
"Yes,
Like,
yes, I do."
really?
So
Like, really?
it's funny because she was just the perfect human being to be born as the first IVF baby because she just has such wit. She really is such a grounded person, and, she's it's incredible. So we wouldn't, women's health, or not women's health, I guess Women's History Month would certainly not be complete without mentioning Elizabeth Carr because she is fantastic.
Yeah. And like I said, follow her on her Instagram page.
Yes.
She's quite funny and, like you said, very witty in her responses.
Yeah,
Just
absolutely.
absolutely adore her.
Yep. And, she did, I don't think she has any of her own IVF story or anything. I mean, in terms of, like, having to use IVF to have her own children, and she didn't have to. I mean, I feel like she didn't have to choose that. I mean, it chose her, but she really just embraced it, and she's been such a wonderful, wonderful, wonderful spokesperson for the magic of IVF because she's a journalist, she's a marathoner, she's just a great woman, so big props to her.
Yep. So, I think that it concludes our Women's History News in the Day episode. So next week we will have some guests on our show,
Yeah.
so we're excited about that. So I hope that everybody has a great week. Thank you for joining us. Please send us an email, drop us a line. We'd love to hear from you. If there's a topic that you want to talk about, just let us know.
Let us know. We're here for it. But until next time, stay safe.